do have a head. Alright, are we all tuned in? Look how I'm like a minute early. How often does that happen? Basically, this one time. Oh, look at all the toys. Look at all those toys. Oh my goodness. What a goof. Alright. That's the wrong end of that toy. Hey Barty. Uncle Barty. Oh. Oh, someone's gonna get you. Barty. Let's see, maybe I should go get the other teams. Here's one. Oh. Belly. Okay, the gang's all here. The gang's all here. Funny. So exciting. All right, time to get started. Oh, there's a squirrel. All right, so thanks to everyone for tuning in. I thought it was time for an update on the miracle kitten. The miracle kitten. He's full of trouble, as always. So in case anyone is not familiar with his story, probably most of you are, but Cassidy, we rescued when he was 9 weeks old from a feral cat colony. He was missing both of his back legs below the knee at the time we rescued him, due to an injury that occurred after he was born. He had horrible infections in both of his stumps and had almost starved to death. He was in really rough shape, but he's a little fighter and he never gave up, and he managed to hold on just long enough for help to arrive. And so because he wanted so badly to live, I promised him that I would do everything I could to help him as long as he wanted to keep fighting. And he is such a special little guy. There's no medical explanation for why he's alive today, because he was in such rough shape. But he just never gave up. And now he's full of trouble. Are you full of trouble? Oh. This is not snuggle time. It's not snuggle time. So anyway, that was about 7 months ago when he came in, and he was really sick then, but actually made little bits of progress every day. Where are you going? Are you like a turtle? And once he was out of the woods health-wise, I started working on physical therapy with him because I wanted him to be able to have the best possible long-term quality of life. And so for the last 7 months, we've been doing pretty intensive physical therapy every day, multiple times a day, to try to get his knees working. He's missing his leg from like here down, or I'll show you on Uncle Barty. It's from about here. From about here down is missing. Not that you can see on this black cat. Here, look, let's see this. There's Barty's leg. It's like missing from here down. You still can't see that, but just trust me. And it, like, if you look at Barty's leg, this is his femur, and his knee is actually here, and then his tibia goes back this way. So it's like, show us on your belly. So it bends, like the knee comes forward and then it goes to the back, and then the ankle's up here, and this is all his foot. Right? So on casserole, let's show off your stumps, buddy. On the casserole, this is his femur, his knee, and his tibia is pointing forward, you can see, and it should be pointing back. So that's what I've been working on for the last 6 to 7 months, trying to get his knees to flex normally, so that we could look at doing osseo-integrated implants into his tibia bones. And then essentially he would have functioning rear leg. Ooh, that was wet. Functioning rear legs like the other cats. So about 3 weeks ago, we gave him Botox injections into his quadriceps muscles, which is here, because his muscles are quite contracted, because when he scoots around, excuse me, I have to show people. I'm not going to use you though, because you can't do it. He scoots around, he has his stumps up like this, and so his quadriceps muscles are freakishly strong and contracted, and that's what keeps his knees hyperextended like this, basically. And then he pulls them up out of the way when he scoots around. So the Botox helped. It helped maybe give him 20 to 25% less muscle tone. And we were sort of hoping that it would relax his muscle enough to make it possible for the other muscles to help his knees flex voluntarily. Oh, there we go. But it wasn't enough. It wasn't enough. And it was sort of our last resort, because the stretching and trying to keep him splinted and everything, all of the physical therapy wasn't helping enough. And so basically a normal cat's knee would bend, like if my leg is completely straight like this, we call that 180 degrees. And then it bends to like 20 or 30 degrees. That's what a normal cat has, between like 180 and about 20 or 30 degrees. Cassidy's legs are permanently at 225 degrees, so they're hyperextended about 45 degrees. And through the stretching and physical therapy, I was able to get his right side to like 105 degrees, and his left side to about 130 degrees, 135 degrees, but it's not enough. And he's still not able to voluntarily flex his knees. So I can stretch him to a certain point, but he doesn't do it on his own. So whether it's just something where his brain never learned how to do it, or the nerves aren't connected properly, or his joint capsule is compromised somehow. We don't really know why, but he has not been able to voluntarily flex his knee. So that's kind of a bummer. But we're at a point where everything we've tried to restore function to his knees has not worked well enough. So rather than continuing to do the physical therapy to try to get his knees working and continuing to sort of lose ground, we started to talk about kind of what the next phase will be for his rehabilitation. So oh bunny, we were all hoping that he would have knees that sort of functioned at some point, but it just isn't possible. So and I've tried I've tried everything. I've tried, every possible thing. It's been a long road, and I wanted to make sure that when if we came to this point, I could look back and know 100% that it is impossible, and that that there was no stone left unturned. And so I can confidently say that it is not possible for him to voluntarily flex his knees at this point. And so kind of a bummer, but it doesn't mean that we still have some good options. So it rules out my favorite option, which would have gotten him, fairly functional legs, like in the normal sense. But we do have some other options that are still not that are still better than the scooting that he does now. A lot of people ask why can't I just leave him as is, because he does get around pretty well, and if you've seen the videos, he climbs the cat trees, and he's pretty mobile at this point. The problem is, well, there are a few problems. One of the things I'm most concerned about is his hip joints are degrading because of the way he scoots around. It's putting pressure on them in ways they weren't designed to bear pressure, and so they're starting to subluxate, and they've actually gotten worse since we went to North Carolina State and got our CT scan. So between then and before we did the Botox, we took some x-rays, and it looks like the subluxation is progressing. And so the longer he stays as is, the worse his hips are going to get, and that's something that would dramatically impact his long-term quality of life. So to me, that was kind of the deciding factor that that made me sort of rule that out as an option. Another option is external prosthetics. Yeah. Which basically would be, he would have to wear a garment that would involve his shoulders and his whole body, and then sort of pants with external prosthetics like braces on them, and potentially get some that would hold his leg in the proper position, and then add sort of a foot on the bottom. It's something that would have to be put on and off. So like in the morning it would have to be put on, and probably at night it would have to be taken off. So it would be a part-time aid for him. Over the last 6 or 7 months, I have had many splints and braces and garments and contraptions that I've put on him, and he gets really frustrated wearing them. So to me, that's not an option that will actually improve his quality of life. It's not something that he will tolerate. It's just something that I just don't think it's a good option. So, oh, Uncle Barty. So, so that sort of leaves us with a surgical solution. So currently, we had our conference call with Dr. Marcella Little out at NC. Bunny! Oh my goodness. Hey, Bartlett. Bartlett. He's very focused right now. Are you going to try to get in on that too? Oh, he's so scampy. Get a timeout. Timeout. So we're sort of left with a surgical option, and so we talked it over, and Dr. Marcella Little is going to start thinking about an implant that can still go on his tibia, which is the bone below his knee, so that we don't have to amputate any more of his leg. But the implant would go onto his tibia, and then have sort of a blade attachment that would give him some spring, hopefully. And that way his knees may always stay hyperextended, and they may be locked in hyperextension. But if we did that, we would not have to amputate more, which I'm reluctant to do. And Dr. Marcella Little is also reluctant to do that. And then, so that's sort of the least invasive surgical option. We just have to work out how it will work and make sure that it will, make sure that it will allow him to walk, to have sort of a functional four-legged gait. basically. So this is not something that's been done before. Dr. Marcel Little is pioneering the field of osseointegrated implants, which basically means it's an implant that's integrated into the bone. It's technology that applies to animals and also is advancing the field for humans as well. So I think it's worthwhile to pursue, not just for Cassidy, but because it will benefit all cats and dogs and humans as well. Dr. Marcel Little and Dr. Ferguson have been involved. I mean, Dr. Ferguson obviously is our primary vet, and she's been involved since the beginning, but we're all on the same page about Cassidy's quality of life coming first. So none of us are pushing a solution that is experimental, in the sense that we don't know if it will work, and we don't know if it, whatever we do is going to be the safest possible solution, the most planned out. It will be modeled, and they'll do practice runs, and we're going to try to keep everything as safe as possible. And I don't know for sure what the end result will look like. We have to wait and see. They're going to have to come up with a design and then test it out, and then, like I said, do some modeling and see what's going to work, and we may have to do some more physical therapy to prepare. And so it's kind of a good news, bad news scenario. I was hoping for his knees to work, but that just was not. It's not possible, and so it's time to start coming up with the next best thing, which is getting whatever permanent solution on there is going to be that is going to be best for him. And then he'll be able to, and then obviously after the surgery, there will be a lot of rehabilitation that will need to be done, because he'll need to learn again how to walk with 4 legs. So, I'm looking forward to moving to the next phase. It was getting pretty discouraging doing the physical therapy, and he didn't like it, and I felt like a jerk doing it, and it didn't seem to be making fast enough progress, but we all just wanted to make sure that we gave it long enough and tried everything and did the Botox and gave the Botox time to work and all of that, just so that we knew 100% that this was not an option. See, that's one of the problems when you have to scoot instead of walk, is that you get hooked on cords. You get hooked on stuff and you take it with you, right? Yes, Dr. Fitzpatrick is doing some similar sorts of things. We have researched every possible thing, every possible person who's doing this stuff. Dr. Marcel Little knows, they all kind of know of each other and know of the work that they're doing. So also the vet in Iowa who did Vincent's legs, they were actually at a conference together last week. So we are consulting with the very best people in the field, like hands down the best people, and so he is going to get the best solution for him, and he's going to have the best possible quality of life. So and you can see that in the meantime he's quite happy and quite healthy and enjoying life, and he'll be enjoying it more now that I don't have to do stretching with him every day, right? Then we like stretching, but I don't think our break's gonna last very long, but I will enjoy it while it lasts, and I know he will too. So think that's kind of the long, rambly version of the update. So we're still hoping to get the implants done, and they won't be exactly in the form that we originally envisioned, but I am somewhat encouraged that Dr. Marcel Little thinks it may be possible to still keep his legs, his stumps intact, rather than having to go above the knee. And then if we can correct his posture and the way he moves, then we can hopefully stop the hip problems from getting any worse. And perhaps they'll go back as he gets older. Perhaps they'll go back to where they need to be. We just don't know about that, but at least it should hopefully prevent them from degrading further, which would be good. So so we are moving forward as quickly as possible. I am assuming it will take several weeks or months for them to design the implants, and I don't know if we will need to do an updated CT scan. We have to do some measurements to see how much he's grown since we flew out there. I feel like he had a growth spurt since then, so if he's grown less than 5%, then we're good to go. But if he's grown more than that, we have to get another CT scan, and we don't know. We'll have to find one that does. They basically have a super fancy one at NC State, and so we'll have to find someone who has that super fancy one, and get some updated scans. Or maybe we won't have to, I don't know. But we will be progressing as quickly as possible. We do have some things that we are doing for his hips. Oh, where did he go? Where did he go? There's muzzle puffs right there. Or stealth muzzle puffs. So yeah, nobody can see you. Thanks for asking what you can do, what we need from you. I think we're okay right now. Just, the continued support and encouragement and understanding is wonderful. Thank you for everything that you guys have already done, and all of the things that you've sent, and the contraptions and the cards and everything. That has meant a lot, and definitely kept me going during some of the tough times. And so, what's this? Oh, Bartlett. What's this? What a goof. What a goof. You're a goof too, Uncle Barty. You're all wound up. You're so wound up. I know. Oh, flop. What are you looking at, Uncle Barty? I think he's watching him and sick, or if he's just always going to be little. I don't know. He's pretty little. But you can see that he doesn't let his situation slow him down at all. How restricted will he be in climbing after the surgery, I'm assuming you're asking? I don't know. These are all questions that we will get into as the design process gets a little further along. We are looking at sort of every possible option, good options, bad options, just to make sure that we sort of threw everything out that we had been thinking before and are starting from scratch, because the sort of parameters have changed and we have more information now about what the situation is. And so we didn't really know with the physical therapy what the outcome would be, so we didn't make a lot of plans design-wise. We had some general discussions, but nothing concrete. So they're going to sort of brainstorm and start over, and we'll just see what they come up with. I've got your blue carrot. So the idea, so how will the implants help his hip function? I'll show you. Oh no, where are you going? Look out, he's way faster than I am. Come here. Where are you going? This is how he should be. This is how he should be moving around, like about this. And with his legs pointing down, his stumps pointing down. And so instead of that, he moves. Look how cute he is, though. Whenever I put him in proper position, his tail is always straight up in the air. He loves it. So instead of having normal cat posture, you can see that he basically bears his weight on his front legs, and his back end just kind of curls under, and then he holds his stumps up out of the way, and that motion is what is causing his hips to subluxate. So basically what he's doing now. So the idea is when he gets the implants, he'll be a quadruped again, and then that will eventually correct his posture. And then his hips will be functioning as they were designed to function. So it will take lots of retraining about how to walk and how to use his new back legs. And so I don't know what it's going to look like, and how they will accommodate the hyperextension versus having appropriate flexion there. I don't know, and I also don't know if there's a chance that after the surgery, the just the physics of walking properly will encourage his knees to go back to a little bit more of a proper position. And unfortunately, there aren't a lot of cats like Cassidy, so there's just not a lot known. But other surgeries like this have been done on dogs and some cat, not exactly like this, but sort of the same concept, and have been very successful. So we'll see, and we're not going to do anything that, like, if Dr. Marcel Little comes back and says, I really don't think there's a way to do this right now, and let's revisit it in a year, then that's what we'll do. But I don't think, he didn't seem like he would come back with that answer, but I think it's maybe a possibility still, but I think he had some ideas, some pretty good ideas. Litter box. That's a lot of people ask that question. How does he do in the litter box? He lifts. I have little ramps for him, or little steps, so he can get into the litter box, and then he sort of lifts his bum over and either leans forward on his two legs, or just sort of like tilts a little, and then, trouble. Sometimes he leaves a trail, like a little pee trail. You can see little like splat, 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 because he usually is moving very quickly. When he's done in the litter box, he takes off, and so when he runs fast, he like, bounces, his bum bounces on the floor. So there's like a little splat, splat, splat. So I can follow his trail and find him, his little pee splat trail. So anyway, that's the update. After the first couple of weeks after our first visit to the emergency vet, they weren't sure that they thought maybe he had a neurological problem that made him incapable of going to the bathroom. So I'm just grateful that he is able to go to the bathroom on his own. And so a little pee splat trail is no big deal. And it doesn't happen every time. It just seems, just sometimes for whatever reason, the, litter box configuration is more conducive to funny. Topper says hi. Hi, Topper. Topper's a big handsome boy. So Topper is in the new video. If you click the link, I don't know if you saw, I posted on Twitter and Facebook about that I was going to broadcast. So if you click that link, you'll see a slightly longer video recapping the first 7 months. And so Topper's in that video. He's very handsome. It's pretty exciting. I'm gonna get this. Did it tickle your thumb? He currently has little sores on both of his thumps. This one on the end. I know. It's no fun. And this one in here. Oh, see? Did you hear that? That was his hip popping. That was your hip. Don't do that with your hip. Nobody wants to hear that noise come from your hip. You can see though, nothing slows him down. He does very occasionally have bad days where he's sore. He gets sore, like he'll bump the tips of his thumps are sore. That's why he holds them up out of the way like that. So they're not sore all the time, but if he bumps them on something, it hurts him. So occasionally because he's rambunctious, he'll smack one on something and then he's sore for a day or two. So I do have pain meds that I give him when that happens. Luckily it hasn't happened too often, but only a couple times actually. And the sores he has now don't seem to be bothering him. I've gotten pretty good at being able to tell when he's frustrated, when he's in pain, and luckily he has a pretty good attitude about all the stuff that I think whatever physical therapy he doesn't like to do it because he wants to do kitten stuff, but he's been pretty comfortable, and I would say that he has not had a lot of pain, which is good because the whole point is giving him a good quality of life. So you don't want to prolong a cat's suffering, but that is definitely not the case for him. So yeah, I mean, his first 9 weeks must have been just horrible. So I think after that, he definitely wanted to live, and I didn't want that to be all he had ever known in his life, because what's the point of that? Right? Right. And now he's very happy. And his little friends keep him busy. So I asked if I should continue any sort of physical therapy or light stretching or anything, or just try to keep his joint, moving. Dr. Marcel Little didn't seem to think that there was much of a need for it just in the short term, while I formulate a plan, and then there may be some different stuff that I can do. Oh, that bunny got you. She got you. She got you. She's tough. That's a tough bunny. She's very tough. You should go get her. Yeah, as far as fundraising goes, I'm hoping to get some sponsorship from other sources, so I am not fundraising for the casserole at this point. I'm hoping that once we know more, we will be able to work something out. We have a couple of ideas. I will let you know if that changes, but at this point, I appreciate the question, but I'm not fundraising for him. We are fundraising for the 4 feral moms over there across the street, though. I'm sleepy. Yeah, so garment contraption thing, basically because of the way where his legs are missing, that it's both sides, and he has a lot of skin mobility, which means that his skin is not connected to his muscle and bone, which means that anything you attach to the skin rotates and goes up and down several inches. So in order to counteract that, he's making friends. He does it in slow motion, because then no one sees it coming. But anyway, anything like that needs actually to be anchored all the way from the neck back. So it's quite cumbersome and quite restrictive for him. And as you can imagine, if you had to wear like a stiff full body brace, it would not be as fun or as comfortable as like not wearing it. This is an epic battle. Barty is Casserole's favorite cat to chase around in slow motion. Slow motion. Yeah, a few people have suggested removing all of his legs. That would be a really extreme solution, and there would be other issues associated with that. It's not good for him to be dragging his man bits on the floor. That gives lots of opportunity for infection and abrasions and damage in that area, where he would probably like to keep that area a bit more protected. Then he would be dragging himself 100% by his arms, whereas now he uses his thumbs to propel himself. So to me, that is a very, very extreme measure of last resort that I don't even know if it is an option. It's not something that we are considering at this time. The philosophy is sort of the least amount of modification to what he currently has is kind of where we want to start, and so that's why we're not doing that. And then there's also a major difference between a cat, like, Anakin he was born without back legs. There's a big difference if it's a congenital issue or if it's related to trauma like Cassidy. So he has normal anatomy, versus a cat with a congenital defect may have been born in a way that adapts differently to not having the rear legs at all. But I'm not saying that's not an option forever, but at this point I think we can do better. I think we have better options at this stage. So the idea is he should be grown enough that he's not going to grow a lot more, but by the time they get the design and everything done and ready to go, he will be fully grown. So even if we do it in the next, I don't know how many months it will take, I don't know how long this part will take, but by the time the surgery is scheduled and everything's ready to go, he will be mostly fully grown or fully grown, and so he won't need to grow. He won't need to have another surgery to have them replaced. So traditional removal prosthetics, again, not to me a great option. They're very cumbersome. He doesn't like having stuff attached to him. He really hates it, and I just don't think that it would provide enough or any improvement to his quality of life. The only thing it might help would be his hips, but if it's something that goes on in the morning and comes off at night, then it's only providing benefit if it is providing benefit for 12 hours. It would require a lot of physical therapy to train him how to use them, and then he has to go back to scooting at night. So I don't think it's a good option. I don't think it would work very well, and I don't think he would like it. I think that it would actually degrade his quality of life. He has hated every splint that I've put on him, and then even having to wear the vest on its own, he doesn't like. And we've been doing it long enough that he has adjusted to it and he accepts it, but he doesn't like it. So external prosthetics to me are not an option. And I've tried everything. So that's a good question. Can he be a tripod with one implant? We did talk about that. So, and we also talked about, would we do one leg at a time and see how it went? But the issue with that, which hadn't occurred to me, is that the way he would have to learn how to walk on 3 legs versus the way he would have to relearn how to walk on 4 legs is so different that we would basically have to do 2 complete, like we'd have to teach him how to walk on 3 legs, and then we'd have to teach him again how to walk on 4 legs. And it would be 2 surgeries, 2 recoveries versus doing everything at once and then doing one rehab to teach him how to walk again on 4 legs. So at this point, that's what we're thinking. He's so slow, you don't even see him coming. Just minding his own business. Gonna get into the catnip. I know, a mind-controlled Roomba would be awesome. His growth spurt has not seemed painful. It was, there was a big change in his physical therapy though. It seemed like his joints were a little bit looser, and as his muscles are getting stronger and more developed, he is fighting it a lot more. He's very difficult. He's in his terrible twos, aren't you? Terrible, terrible twos. Oh. Yep. So that's sort of the update. Yes, the air mattress could be bought locally to avoid shipping costs. And thank you very much. I don't know why that happens sometimes, but yes, anything similar would be good. So I think that's it. I'm not seeing very many more questions. Thanks for CCing. I know that I talk fast. I know I have been considering having a sleepover with Sky. The only issue is I don't think I would fit in the bathroom, and then if I opened it up a little bit, then she may find a new spot for her nest under a dresser or something. So, anyway, thanks for tuning in. There is a Miracles Kitten playlist on YouTube with a lot of his, with I think most of his videos that I enjoy watching sometimes. Sometimes we watch it together. And remember when he was so little. Oh, I'm ready for a nap. It's been intense over here. So, Sky, I don't know. Sky seems like she's getting less comfortable. I'm not sure where she is right now. She was behind the nest, but I don't know if she moved. Oh, okay. So anyway, thanks for tuning in. I'm going to go, and I'll probably be over to do Sky Meds in a little bit, and the kittens are out and about, so I do still think she will be adoptable. Yes, absolutely. Can I tell Hudson and Chaz apart? No, not yet. And also, Neelix's two gray tabbies are hard to tell apart, and one is very subtly a boy. I'm like 80% sure he's a boy, but it's very subtle back there. So there are a few other things. When I was looking at the pictures, I noticed like a few minor differences. So I'm going to get another. I just wasn't sure which one was which in the photo. So next time I check on them, I probably will try to give it a couple days before I steal them again. They're so cute. Oh, so cute. I will post this video here, so if anyone misses it, they can come and watch. Hopefully I answered most of your questions. So, alright, we will sign off for now. Here's the Miracle Kitten close up. Oh, he's so handsome.